let's revisit a hematocrit and the proper procedure for taking one. A hematocrit test looks at the percentage of red blood cells in a whole blood sample. Red blood cells are in charge of carrying oxygen all around the body, and our cells need that oxygen to work properly and make energy. We went over more of the details and normal values in a previous video, so feel free to check that out. And while you're at it, take a look at our other video that walks you through the correct capillary puncture procedure. Let's take the test from our patient. First, you need to gather the proper supplies. This will be the lancet you need for the capillary puncture, the alcohol prep pad, a microhematocrit tube, a clay sealant tube, some gauze, a bandage, and a centrifuge to complete the test. Next, you need to review your procedure for a capillary puncture. Once you have all of your supplies ready, you will choose a proper location for the capillary puncture. Once you have some blood flowing, you can collect blood one of two ways. One is to collect the blood sample into a small plastic container called a microtainer. You would place the drops of blood in the container by wiping the finger you have punctured against the lip of the container until it is filled with blood. For a hematocrit, you want to use a lavender top EDTA tube color. More commonly, you will fill the microtubule directly. Some microtubules come with no line and are a thin glass or plastic tube that is open on each end. Some tubes have a red line on one end, indicating the presence of an anticoagulant in the tube. If the red line is present, you want to place the side away from the red line to the patient's finger. Place the end of the tube up to the blood that is flowing from the patient's finger and angle the tube slightly in the downward direction so that you can fill the tube more easily. You want to fill the tube 2/3 to 3/4 full. It is important not to overfill the tube. Do not angle too steeply as you do not want to have air bubbles in the tube, just blood. If you are using the tube with the red line, invert the tube a few times to mix with the chemical. As the tube is open at both ends, placing the tip of a finger over one side of the opening is helpful. Once the sample is ready, place one of the tube in a sealing clay. Press gently as the tubes may break if you are too rough in handling. Ideally, you collect 2 samples to test as a control. Once sealed, you are going to place it in the centrifuge. Make sure that as you load the centrifuge that you place the end that has the clay towards the outer rim of the centrifuge tray. In addition, you should evenly load the tray by placing the microhematocrit tubes as evenly as possible in the tray options. Make sure that you place the top securely over the samples and spin for 5 minutes. The speed should be 10,000 to 12,000 revolutions per minute. Wait for the centrifuge to come to a complete stop before you open the top of the centrifuge. Now we are ready to read the values and record them. Place the bottom of the tube on the scale at the 0. Make sure that you line up where the red blood cells start at the 0 and not the clay at the 0. Find the correct scale before you take the value. The correct scale is the one where the red blood cells start at 0 and the end of the plasma is at the 100. This is why you see a scale that is varying widths. Once you have found the correct scale to measure against, you will find the number where the red blood cells end. This is the value that you will record as a percent. If you collect 2 tubes, you minimize the need to take a second sample if one breaks, and you can check the precision of the values by comparing the value of the 2 samples. After the procedure, make sure that you dispose of your materials properly. The microhematocrit tubes go to the sharps container, and any softer materials that are contaminated with blood belong in a biohazard bag. Never forget your patient. Make sure that they have stopped bleeding and are okay to leave before you run the blood sample. If you are running multiple samples from multiple patients, make sure you label each tube. Each tray has a number, so make sure that you are keeping an accurate document on the location of each patient's blood sample.